Hi, my name's Georgia from BN Australia. I'm a physiotherapist and expert in pelvic floor physiotherapy, and today I'm going to go through with you how to use BN dilators in different positions. So if you've been using dilators on your back or on your side and you're ready to start advancing your techniques or your positioning in anticipation that you might be going back to sexual intercourse, then these are a few techniques that you might want to try or positions that you could try it in. So when we think about the dilator going into the vagina on your back, it's quite a uniform position. So it's just going straight into the vaginal canal. There might not be much contact with either the front or the back wall of the pelvic floor. Once the pelvis or you get into different positions, so say 4-point kneeling or you on top in the case of sexual intercourse, things are going to move around. The pelvic floor is going to be touched and penetrated in different positions, assuming that you're having penetrative intercourse. So I'm going to go through a few different techniques or positions that you might want to try with your dilators. We've made our dilators with a flat base, so all these positions are achievable and comfortable for you to use so that you're not just stuck lying on your back or on your side to use your dilators. So the first one that you can try is 4-point kneeling. So think doggy. So if you get into a 4-point kneeling position, you could put the dilator in a sitting position, so you're inserting the vagina into the vaginal canal like you would in any other position, and then you might hold pressure on the base of the dilator and then get into that 4-point kneeling position. Once the dilator is inside the vagina, you could either hold it there, pop your undies back on so that it doesn't fall out, and you might just stay in that position practicing some deep breathing techniques like our box breathing, our belly breathing, so a big encompassing inhale, nice big exhale, and just play around with how that feels in that position. You might then also rock forward and backwards with the dilator in, and again you might have undies or tights on so that the dilator stays in place, and just see how that feels as it moves or as it changes positions inside the vaginal canal. You might then also come down into like a high child's pose position, and again practice some breathing techniques or move your body forward and backwards. And if you want to really challenge your pelvic floor and your hips, you could turn your toes out and then move your hips forward and backwards, and just see how that feels with the dilator inside the vagina in that position. So that's number one. Number two, you'll need a pillow for, and you can get a pillow, or I've got a yoga bolster in this position, and this is practicing you on top. So the dilator can go inside the vagina again. You put it in just as you normally would, and then with the base you're going to sit onto your pillow or onto your yoga bolster if you've got one. In this position, initially it might feel a little bit more uncomfortable or a little bit more pokey inside the vaginal canal, depending on the size or how sensitive the vaginal canal still is to penetration. So in this position you might initially want to focus on your breathing, letting the belly expand, letting it recoil, and eventually you might want to move to some movement. So maybe you're tilting your pelvis forward and tilting it backwards, maybe you're moving your hips in a circle, maybe you're having a feel of what it feels like to lie all the way down, or maybe you're having a feel what it feels like to move all the way back. So we're really thinking functional training. How might you be having sex? How might you be going back to penetration? Do it in a controlled way first. You're in control. If it feels gross to go forward, you stop. If it feels gross to go back, you can stop. So it's a really safe space. It's a great opportunity to show your body that you can be okay with penetration. It's not a threat. It's not going to harm me. So have a play around with positions in this position. You then might even want to go into a deep squat. So you could then bring your feet either side of you, and still the dilator's inside, and you might then play around with rocking forward or back in this position. Maybe you have a play around with lifting and lowering your bum up, so a little bit of in and out of the dilator inside the vaginal canal. There's no right or wrong. You can have a play around with all of these positions and see how they feel. The other option that you can try is on your back. So a lot of people say that deeper penetration is uncomfortable. So you might already be doing your dilators like this, in this position, or in a position like this. Have a play around with what it's like to insert the dilator. Again, you might put undies or tights on, and then come up into a position like a happy baby. So lots of the time I hear that a position where my legs are over the shoulders is uncomfortable because of the depth of penetration. So you could try that position and see how it feels. You could also do this at a wall where your feet are up against the wall, and you can then have your hand on your vulva and vagina and be pushing the dilator into the vaginal canal or moving it around a little bit more to see what a position like this feels like for the vagina and for the vulva. There's really no limit on how many different positions you can try, but those are just a few that you could give a go of if you're feeling feeling like you're ready to progress from the normal lying on your back or lying on your side positions that most people start with, and if you're starting to look at a transition towards intercourse. You can of course also try them in standing, so if you're thinking about having sex that might be occurring in standing, so in the shower, in the kitchen, you name it, the world's your oyster, then you could definitely progress to doing it in standing as well, leaning forward, holding the dilator in. Heck, you could take it into the shower and give it a crack in there. So try as many different positions as you can, you're in control, and you can stop whenever you need to, so it's a really safe space for you to explore different positions, different techniques, so that you have no concerns about going back to intercourse with a partner. If you want more information about pelvic pain dilator usage, you can head to bn.com.au.